asymmetries that I see. So, you guys see any asymmetries as you kind of look at Maggie?
Her right side looks more muscular.
It does. It looks a little bit more muscular, right? It looks a little bit more hypertrophied and on her right, but actually the lack of really definition across the board is what I kind of notice quite a bit. So that's really something I would appreciate. And then as we come up here, that these guys are kicking on a little bit more. So just as I put my hands on to assess the fascia, I'm going to want to think about really what's going on underneath that area underneath there, okay? I like to kind of assess bilaterally just to kind of see what is happening and do, again, just those longer strokes. If I'm working on this side, a lot of times I like to stand on the opposite side. I get a little too jammed up if I'm same side. Okay, so just know that I'll move around a lot on the table when I need to make sure that I really can get the best advantage. Is that okay? Mm-hmm. Pressure-wise, how much pressure is that?
It's probably like a 2.
Yeah, good. Which is what I was going for. So, great job. Not an 8 like some of you. Dr. Heveron's coming. Oh no! Okay, and as we come down, just appreciating that she actually has pretty nice tissue all the way until we get about right here. And it's really tight and bound up, and there's more mass than I would expect underneath my hands. So just to start off with, I might say, okay, I'm going to split the sides. Like I might want to work on the right side and then the left side, because I know that a lot of times pain bilaterally will happen. She came in really hot, and it was really only the right side really shifted, really listed away from that side. I'd go right for the gusto and go on the side of pain. So we're going to still do that forearm technique.
Uh-oh. Did you
Someone unplug it for me so I don't trip over myself. No judging when you guys watch it because we're wearing our tennis shoes.
It's okay, we'll edit that out.
Well, you were in my
I was like, how can you be able to see it? Put a filter on it.
So guys, part of my assessment too, I would have assessed the tissue, but I would have come in right away and assessed each joint intersegmentally, not only central but unilateral, especially because she's having more issues on the left. I want to know if she's rotated and tilted, okay? And just given what we see and what I feel, she's rotated this way, okay? So I would just want to know what I'm getting into. So you're going to work the same way. You're going to come down into that. Maggie, you okay? How much pressure is that?
Probably still like a 3.
Yeah, so pretty light as we go along. Just because Maggie's saying it's a 2 out of 3, but her face told us a different story. I feel like when she got into those lunges, her whole body did not want to go there. So I'm not going to go for the gusto with her body. She just didn't seem like she would be able to really handle that as we were going through our pre-assessment, okay? So I'm going to come all the way up, and a lot of times I'm going to come back through. So one of the mistakes that I've seen you guys make is just in general, if we're doing this technique, I'm rolling all the way up, is trying to come back down, okay? Just roll all the way up, and then use your hand to come underneath, and now go at it again, okay? You can swipe caudalito-cranially, or you can go opposite, because I want to know that I'm affecting those. A lot of times I like to do this, and as I'm going, I'm moving down, but as I come into here, now I can go at the top of the pelvis, come down in through there. You okay, Maggie? Because as the hip flexor comes in and inserts there, and also the QL comes and inserts in there, I'm going to shift my elbow, and then I'm going to come and ride all the way along that pelvis. You okay? How much pressure is that?
Like a 4 to 5.
Okay, and does that feel good, bad, good, bad?
Just uncomfortable.
Like uncomfortable in a good way or